that we can make sure that the patent laws don't prevent new products from getting to the market the way they should? Are there ways that we can do a better job negotiating for better prices? So there are going to be a whole host of things that we're going to be doing. It's not like we're going to be standing still during this 10 years, but what this law does is it guarantees that help and makes sure that a decade from now it's going to be completely eliminated.
Thank you, Mr. President. My understanding is we have folks standing by around the country. So the next question will come from the audience. Operator?
Thank you. Your first call is from Barbara Franklin from Rainsville, Illinois. Barbara, please
it's like magic.
Mr.
President, my name is Barbara Franklin. I'm president of the Illinois Alliance for Retired Americans. My question is, will the reduction in subsidies to Medicare Advantage plans cause these companies to reduce coverage to senior plans?
Well, it's a great question. Where are you calling from in Illinois? Town.
Yeah.
Tell everybody back home I said hi.
Hi, Phil.
This has been an area where the most misinformation and concern after the death panels. Remember those. For those who are not familiar with it, and I want to make sure that I explain this as clearly as possible, Medicare provides a guaranteed benefit. And then a while back, a law was passed saying we're going to have a program called Medicare Advantage, in which we pay insurance companies to provide Medicare benefits. All right, so the insurance companies are supposed to manage these Medicare benefits. There are examples of where Medicare Advantage has been a good deal for some seniors. But overall, what happened to the program is that insurance companies were getting paid on average $1,000 more than the costs of regular Medicare. Okay? Now, by law, insurance companies were supposed to be providing additional benefits and better services, $1,000, but a lot of it ended up going to profits, CEO bonuses, and their bottom lines. What's more was if you weren't signed up for Medicare Advantage, we're still paying higher premiums for somebody else's Medicare Advantage. If you're in regular Medicare, which is about 77%, so 3 out of 4 of you who are in Medicare are signed up for regular Medicare, and 1 out of 4 of you are signed up for Medicare Advantage. Who aren't in Medicare Advantage, you're actually paying a higher premium for that extra $1,000 going to the insurance companies. That didn't seem like a good deal. That doesn't seem fair. So here's what we did under the law. What we said was, you maintain Medicare Advantage, but we are going to say to the insurance companies, you can't use this just to your profits, pay higher CEO bonuses. 8% of what you spend has to actually be for health services. We're going to review the rates that applied. We're going to set a rate that is fair and appropriate. That Medicare Advantage isn't costing people who aren't in Medicare Advantage. So those are the changes that we've made. Now, that is, by the way, where we are obtaining the savings here. It's by eliminating some of these insurance subsidies that were unnecessary for the program. But we have not eliminated Medicare Advantage. Insurance companies can still make money on a well-managed Medicare Advantage program. You know, helps to manage and coordinate the prescription drugs and all that stuff. So for administrative convenience, Medicare Advantage may still end up being a useful program for some people. We just want to make sure that that money is not just a big giveaway to the insurance companies. And this was costing Medicare overall around $17 to $18 billion every year, with a B, right? So part of the way that we pay for the improved benefits in donut hole is to say we're going to take some of that money from the insurance companies. Still be able to make money. And there are seniors who are under a Medicare Advantage plan that is doing a good job have nothing to worry about. If you're signed up for a Medicare Advantage program that is wasting money, then we're going to be just telling those insurance companies you got to stop wasting the money. And that I think is something that everybody expects us to do, is overseeing a program so that it lasts over the long term. Anything you want to add there, Kathleen?
I think the President did a great job answering that question. Let's take the next one from the audience. Sir, in the back.
My name is Pat Oliver. I'm 69 years old, and I have heart disease, high blood pressure, incurable fast-growing prostate cancer. I have a couple of other chronic conditions and special concerns as a transgender person, and in addition, I'm allergic to some of the drugs that would most be used to treat my conditions. I'm actually doing the wise things for myself and am still productive in several ways. One of the big reasons for my sustained good health is my primary care physician, Dr. Gail Pogar. In addition to being a good doctor, she is an outstanding advocate in coordinating for my sometimes complex care. I believe significantly more money can be saved in Medicare by directing more resources to primary physicians for coordination and patient advocacy, and less to the complex organizational programs that have the same purpose. Instead of buying expensive football teams, what we need is more archers.
Well, let me, I'm not going to comment on football, because most people around here, Ravens fans or Redskins fans? I mean, I'm just not sure. I just wanted to make sure, I don't know. This is why I didn't want to talk about football. And we got a Navy person here. This issue of primary care physicians is absolutely critical. And it has the promise of making such a big difference in the overall health of everybody, from children to seniors. It used to be that most of us had a family doctor. You would consult with that family doctor. They knew your history, they knew your family, they knew your children, they helped deliver babies. Consequence, what happened is that everybody got regular checkups and could anticipate problems that are out there. In these big medical systems, so often what happens is that you're shuttled around from specialist to specialist. Oftentimes people don't have a primary care physician that they're comfortable with, so they don't get regular checkups, don't get regular consultations, preventable diseases and being missed, and you don't have the kind of coordination that's necessary between all these different specialists, right? So you go to one doctor, they take a test, then you go to the hospital, have you take the same test. A lot of errors occur because communications between these various specialists, and it adds a lot of cost. The time that test is being taken, they're charging Medicare, and if you're not on Medicare, they're charging the insurance company, and that is part of what is adding to all these costs. So what we've been trying to do, this was a major focus of the Reform Bill, is how do we get more primary physicians, number one, and number two, how do we give them more power so that they are the hub around which a patient-centered system exists. And first step is getting more primary care physicians. I mean, sadly, a lot of young medical students, they love to go into primary care, but primary care physicians don't get paid as well as specialists. So they say to themselves, you know what, I don't want to cut all these school bills that I got to pay. I've got to be a plastic surgeon or something. part of the bill was to loan forgiveness programs and other mechanisms